working or practicing as an Ayurveda consultant at his website is given gentlebirthmethod.com. He is actively involved in all party parliamentary group working for Indian traditional system of health and well-being, and also as a board at British Ayurveda Medical Council. So, सर हमारे बीच में काफी दूर से यूके से हमारे बीच आए हुए हैं, सर का बहुत बहुत स्वागत है और मैं की अध्यक्षता लेती हूँ। सर अब वह क्षण आ पहुंचा है जिसकी हम सभी को प्रतीक्षा थी। मुझे अत्यंत हर्ष एवं गौरव का अनुभव हो रहा है कि मैं आयुर्वेद जगत की एक विशिष्ट एवं प्रेरणादायी राष्ट्रीय आयुर्वेद संस्थान के माननीय कुलपति महोदय प्रोफेसर डॉक्टर संजीव शर्मा सर को मंच पर आमंत्रित करूं। सर प्लीज आपके दूरदर्शी नेतृत्व एवं आयुर्वेद शिक्षा अनुसंधान तथा वैश्विक स्तर पर भारतीय चिकित्सा पद्धति के संवर्धन में आपके अमूल्य योगदान से हम सभी प्रेरणा प्राप्त करते हैं। सर के अथक प्रयास का परिणाम है कि एनआई जयपुर ने QCI NCISN से A3 प्राप्त किया है। साथ ही साथ एनआई जयपुर फर्स्ट रैंक घोषित हुआ है। जितने भी आयुर्वेद कॉलेजेस हैं इंडिया में, तो एक जोरदार तालियां सर के लिए। सर का एक संक्षिप्त CV है जो मैं आपके समक्ष रखना चाहती हूँ। वैसे मैं सर को आमंत्रित करती हूँ उद्बोधन के लिए।
Hello. Very good afternoon to everyone. Namaste. Thanks, coordinator, for inviting me and giving me this opportunity to share certain views with you people. First of all, my congratulations again to the institution for the centenary celebrations, and my best wishes for all the activities which are going on through these 2 days and for further journey of the institute. All the respected experts of Ayurveda and their students, what the topic I have decided to discuss with you is just the topic of this conference which the organizers they have planned. That is Ayurveda and the future of global healthcare, from traditional wisdom to the evidence-based, personalized and sustainable health system. So there are certain very typical terms that from a traditional wisdom to evidence-based. So the question arises that Ayurveda, being a traditional system of the Indian knowledge system, is not having any evidence. Of course, we are having the evidence. We are having the classical or coded evidence. We are having the experiential evidences. But those evidences are not considered as the authentic evidences in today's scientific world. Then personalized and sustainable health systems. Now, Ayurveda, of course, is a personalized health system. It is not just, it does not only treat the disease, but it takes care of the person as a whole, and it deals the person in a holistic manner. So it is, of course, personalized medicine system, health system, and it also takes care of the sustainability of the health system. But now the question arises that how to amalgamate, how to integrate, or how to produce Ayurveda as a medical science or as a science of life in today's world when we are in a different kind of the scenario. What the different kind of scenario is that today the science as a whole is in its almost highest glory. And this glorification, this progress of the science, it will continue to grow. What today we are having in the scientific world, tomorrow that is outdated, and tomorrow new theory, new principles, new designs, new machines, everything is new tomorrow. And what tomorrow will be, that will be outdated for day after tomorrow. So science is growing very fast. This is one thing. Then second thing is, next please. Is there any changing the slides? So, at the one end, science is growing and it is in the highest glory. Then the medical science itself is at its highest glory. Now, it is not just the medical science which was just 10 or 15 years ago, but this is now entirely new medical system which is having multiple tools, multiple devices, multiple diagnostic methods and multiple therapeutic methods. Many things are there which are new, and the growth is exponential in the medical world due to the scientific innovations. And third thing is the artificial intelligence which is coming on the way. Today when we are talking in our session, then also I gave the hint about this, that the artificial intelligence is now the reality of life. It has an impact upon all the spheres of life, all the spheres of the science and day-to-day activities. So the medical science is also not devoid of or cannot spare itself from the artificial intelligence. And it is now mandatory or essential to integrate or to use artificial science for the benefit of the society in the medical science or in Ayurveda. Then another vertical which is standing there, that is the Ayurveda or traditional complementary and integrative medicine systems. So these are the systems which are having the ancient wisdom, experiential learning and experiential evidences. So these four forceful, or we can say that strong factors are there, but still the disease burden in the society is increasing. Now this is the question, that why, when the science is advanced, medical science is advanced, artificial intelligence is now coming up and Ayurveda is already there, then why the disease burden in the society is increasing? That is a big question. And this is the paradox, that we say that the medical science has got exponential advancement, but the fact is that the disease burden in the society at national and international level, it is increasing, and it is increasing manifold. So this is the big paradox which we have to attend. And what I personally feel, that Ayurveda can give the results and can give the solution for this big problem. The increasing disease burden, that can be reduced by Ayurveda, but that will mean definitely the generation of the evidences. Because if we will say that this is written in our text, that may be a holy sentence or holy idea for we people as Ayurveda present. That may be the Aptopadesh for we people. That may be a principle for we people. But today's scientific world or today's modern world will not listen to those all principles unless those are proved by the scientific evidence or the language which today's world understands. So, my whole discussion is on this part, that we are having the good questions, good hypotheses in Ayurveda, but we have to, and we know that the results are there, but the missing is the evidence. That evidence we have to show. Next. Yes. So, what if the health care system of the future was designed to protect health? अगर आज की डेट में हमें कोई health system design करना होता, if you would have to design today a health system, what would have been our direction? How we have designed that health system. That is the question. Because the existing contemporary health system has been designed few years ago. At that time the scenario was different. This system just focused on the treatment of the diseases, nothing more than that. But now the scenario has changed. So now we have to, the conventional way of the medical system is that disease, I'm sorry that whole slide is not visible, part of the slide is there. Conventional way of thinking is the disease, the diagnosis and the treatment. Whereas the suggestive way or the way should be, that should be the health, risk recognition, prevention, resilience and healthy aging. And here what in the pictures we have tried to show, that there, the first picture that shows the hospital scenario of a patient. Here the existing medical system that generally focuses on the treatment of the disease. But where we have to go to prevent the diseases, we have to take care of the person, not as a patient but as a person, and that too in a holistic way, so that should lead into the healthy aging. Because healthy aging does not mean that it is only the old age. We are aging. Everyone is aging. After birth we start aging. And with the age many changes in our body do occur. And we have to attend and address those changes. And those changes can only be addressed not by the conventional way, but by the typical way and the way Ayurveda tells us that how to deal. And then if we generate the healthy aging, that will result into the healthy society, healthy nation and healthy world. And that is the, we can say, hypothetical thinking of the today's scientists, that how we can generate a healthy world. Next. भैया स्लाइड जल्दी चेंज किया करो. The world is living longer, but are we living healthier? This is a big question. Today, the life expectancy of each individual in every nation has increased. The life expectancy in India at the time of the independence, it was almost around about 47-48 years. Average age. But now it is around about the 72 years in India. And globally also it has increased around about 73 to 74 years. But the increase in the lifespan of a person, has it resulted into the health also? Because when aging is occurring, lifespan is increasing, the disease span is also increasing. In this graphical presentation you will see the life expectancy, health span and lifespan in a straight line that depicts our life, whole life, person's life. But health span is shorter one, and disease burden means disease span of an individual when he ages, that starts. Many diseases after 40 years or 45 years of age or 50 years of age they will start. Now that span of life which is loaded with the diseases, that is causing the overall disease, apart from the traumatic and other infectious disease in other age group. But in this age group, means when the age crosses around 40, 45 or 50, then the diseases will start. Those diseases may be metabolic disorders, those may be some life disorder or some other kind of disorder, but diseases will start. So the target is to reduce this disease burden through Ayurveda and to generate that evidence also, so that the modern world or today's world that can understand. So the challenge is no longer only to add years to life, but to add health to those years. And WHO focuses on the healthy aging and to reduce the global burden of the disease in the aged population. Humanity has achieved a remarkable longevity, but the additional years are increasingly accompanied by chronic diseases and disability. The real challenge for 21st century healthcare is therefore not simply to extend the lifespan, but to extend health span. So we have to build a system that is excellent at treating, but has already happened. हमने अभी तक जो सिस्टम बनाया वो जैसे मैंने पहले कहा, but I already told that we have created that system which is treating the diseases. वो diseases को treat करता है, but the next frontier is to identify what has not yet happened. Means when we have to attend that person also where the disease has not yet happened, we have to prevent the disease in that person also. Not only to focus upon बीमार की बीमारी ही treat करना नहीं है, बीमार स्वस्थ व्यक्ति बीमार ना हो. That is also a big responsibility upon the medical world, and that is required to be attended. So from the medicine, it should be from reactive medicine to reflective medicine, or we can say from reactive medicine to anticipatory health. We have to assess the persons, we have to prevent convert a person into the patient. Right now what is happening, persons are being converted or they are naturally converted into the patients, and then patients are being attended by the medical science. So we have to reverse this phenomenon, we have to attend the persons and to prevent them to become the patients. The greatest healthcare intervention may be the one delivered before the person becomes a patient. So why Ayurveda, why now? Now, in this scenario, when the disease burden is increasing and the society or today's world is demanding the evidence, then what is the role and why Ayurveda and why it is now? Because Ayurveda talks about the prevention of the diseases. It talks about the prevention of the diseases, we all know. It also talks about the personalization of the health. And it talks about the system thinking. What is the system thinking? System thinking means it talks about the body, it talks about the side, and it talks about the globe, means Brahman. It talks about the environment, how a person can live in an environment and how he can accommodate himself within the environment and how he can protect the environment so that environment should not cause diseases to the person and person should not spoil the environment. So Ayurveda talks about all these three factors. That is why there is the strong need of Ayurveda to intervene now at this point of time. Ayurveda enters the global conversation not because it is ancient. हम सिर्फ प्राचीन हैं, भारतीय परंपरा है या भारतीय ज्ञान है, इस कारण से ही आयुर्वेद का महत्व नहीं है. Because it is written in our text, that is not the important for today's world. Is it proven or not? Are we having evidences or not? And we have to generate evidence, we have to change our mindset, and we should try to generate evidences. So far as our journey of Ayurveda is concerned till now, we have not generated the evidences which are required, and we need to generate those evidences. Ayurveda enters the global conversation not because it is ancient, but because some of its questions are profoundly contemporary. But the Ayurveda talks, the today's modern medical science that has started talking about personalized health. That is the talk of today in modern medical world, and that was the principle of Ayurveda. Ayurveda talks about the prakriti, Ayurveda talks about the doshas, Ayurveda is having its own concepts about the sharira and physiological principles. And those principles are very, very true in today's scenario. So the missing middle of the modern healthcare. This already we are talking about that what actually is there. In the modern medical world, there is health and there is disease. What is missing in between? In between the health and disease, there is something missing, and that the missing concepts are susceptibility, loss of resilience, early dysfunction, and silent progression. These are the missing things which we can call as the missing of the middle in the modern medical science or modern healthcare system. So the next generation of the healthcare must learn to recognize the transition, not merely the destination. So how a healthy person is becoming a diseased person, there is a journey, and that journey we need to recognize, and we need to intervene or interrupt that journey through our ancient principles, through our ancient or Ayurvedic interventions, so that a healthy person should not convert himself into a diseased person. So we have to identify that missing middle. So window of the opportunity. Ayurveda, the new frontier of health. We all know that who are the students of Ayurveda, that there is a concept of the Shadkriyaka. And Shadkriyaka are the different opportunities at different stages to treat or to intervene or to prevent the diseases. And if we miss those opportunities, the ultimate result is the disease. So anticipatory healthcare is the predict, stratify, intervene, and preserve. So if we draw, slide change here. Change. Next. Yes. So here we see on the right part of the slide, there is a flow: health, predisposition, loss of physiological resilience, subclinical dysregulation, preclinical disease, clinical disease, and complications. This is the today's scenario when they talk about the conventional medical science. When it talks about the personalized care and preventive aspect, they give this flow chart that starts from the health to the complication. And similarly, our Shadkriyaka also says the same. So what we have to do, we have to understand our principle, and we have to intervene at the different stages. We are right now, what our approach as being Ayurveda experts also has changed. We are mainly treating the disease. We are not really working upon the preventive aspect of the disease. Although we say that Ayurveda says that prevention is better than cure, but swasthya se swasthya rakshana, this is our principle. But how much we are working on that? That is the missing link in Ayurveda. We know what is Shadkriyaka. We know what is the natural Sanchaya Prakop Prasar or pathological Sanchaya Prakop Prasar of doshas. But we are not attending those things, but just we are focusing upon the treatment of the disease. So directly, indirectly, we have converted into ourselves like the contemporary medicine. The patient comes, we diagnose the disease and we treat the disease. That is the scenario in today's practice. Almost 90% practice is going on like that. But we have to change this scenario. We have to think about the prevention of the disease. We have to think about the generation of the evidences, and we have to think about the intervention before the disease has established itself. Only that the relevance of Ayurveda. Otherwise, we are just like contemporary doctors, patient coming, diagnosing, and then treating. The critical question for future healthcare is not simply whether we can treat a disease, but whether we can identify the window when disease is still modifiable. For example, nowadays there is the concept of the reversal of the diseases. Diabetes, this is the concept of modern medical science. हम डिजीज को रिवर्सल करने का सिद्धांत हमारे पास है, लेकिन हम उन सिद्धांतों को तब कहते हैं जब मॉडर्न साइंस या मॉडर्न वर्ल्ड ये कहता है कि ये है, तब हम कहते हैं यस, ये तो हमारे पास भी। जैसे अभी वो एक इंटरमिटेंट फास्टिंग पे किसी को नोबेल प्राइज मिला, हमने कहा ये तो हमारे आयुर्वेद में सिद्धांत है लंघन का। उपवास का हमारे यहाँ एकादशी उपवास का सिद्धांत है हमारे यहाँ, लेकिन हमने उस सिद्धांत को कितना अपनाया और उस पर कितना डेटा जनरेट किया और उसके रिजल्ट को क्या एनालिसिस किया कि नहीं। इंटरमिटेंट या लंघन जो हम करवाते हैं, क्या उसको कभी एनालिसिस किया हमने? क्या उसके बायोमार्कर्स को हमने स्टडी किया उस वक्त और कोई रिजल्ट दिया? नहीं। सिद्धांत था, लेकिन हम उस सिद्धांत को भूल गए, लोगों ने उसको अडॉप्ट किया और उस पर नोबेल प्राइज दिया। सिमिलरली हियर आल्सो the diseases according to Ayurveda, many diseases according to Ayurveda are modifiable, are reversible, or they can be prevented before those diseases are established. But still, we are not doing this, is unfortunate. So nowadays, diabetes mellitus is such a disease which is considered that once it has taken place, it will continue as such throughout life. And the patient has to take the lifestyle measurement and then medications, etc., etc. Similarly, hypertension. But these diseases are modifiable and reversible if proper treatment. And this I am talking from modern point of view. They are saying that this can be reversed. But what are the principles when they talk about the modification of the disease or reversal of the disease? What are the principles? The principles are entirely based on Ayurvedic science. But we, as Ayurveda experts, are not using those principles. Can't we go into the reversal of the diseases? Can't we think about the modification of the diseases? Can't we think about the prevention of the disease in a drastic way? This is the reality that we are not working upon this prevention of the disease. This is the reality that we are never working on the reversal of the disease. Many diseases are reversible, and on the basis of the principles of Ayurveda. But this needs to be practiced, and that is why I am saying that we need to change our mindset from direct patient approach that we have proper. ठीक है, जब कोई पेशेंट आता है उसकी चिकित्सा तो करनी है, लेकिन उससे पहले भी क्या कोई अपॉर्चुनिटीज हमारे पास हैं, एंड वी हैव टू रिमेंबर द षड क्रियाकला इज वेरी इंपॉर्टेंट एंड यूनिवर्सल प्रिंसिपल वेयर वी कैन ऑन द बेसिस ऑफ दैट वी कैन थिंक. Ayurveda tells that this everybody studies. हम BMS फर्स्ट ईयर से ये पढ़ते हैं, हिता हितम सुखम दुखम आयुष्स्य हिता हितम मानव चित्तम आयुर्वेदा से. इसका मतलब क्या है? क्या इसका डीप जो मीनिंग है उसको कभी उसको समझने का और उसको प्रैक्टिस करने का, समझने का नहीं. समझने के तो बहुत विद्वान होंगे जो बहुत अच्छी तरह समझा सकते होंगे, चक्रपाणी की टीचर पे उस पे बात कर सकते होंगे. But the practical implicability of this principle, this important principle, that how our this life, it is not only just as I said in the earlier slides that are you changing the slide accordingly? I'm sorry. Yes. So now how the life can remain cool and calm and pleasant, and how the life will be useful for myself, for my family, for my society, for my country, and for the humanity. These are the two big principles of Ayurveda which has given. But for that, I have to keep myself healthy. If I am not healthy, I can't serve the society. And Ayurveda tells that what are the significances of Hita, Hitam, Sukham, Dukham. Ayurveda is concerned with what is the beneficial, harmful, and the determinants of the life. Ayurveda does not ask only what disease does the patient have. आयुर्वेद यही नहीं पूछता है कि सिद्धांता आयुर्वेद यही नहीं पूछता कि इस व्यक्ति को क्या बीमारी है. इट आल्सो आस्क्स व्हाट इज द राइट वे ऑफ लिविंग फॉर दिस इंडिविजुअल. ये भी कहता है कि इस व्यक्ति को जिसको ये बीमारी है उसका सही तरीका उसके जीने का कैसे होना चाहिए, उसका जीवन कैसा होना चाहिए, सो दैट द डिजीज कैन बी ट्रीटेड इजीली एंड इट कैन बी रिवर्स्ड. So the next biomarker we need to discover is the resilience. Resilience means जिसको हम व्याधि क्षमत्व. Our body, our food system should be resilient to bear the stresses, today's stresses. We are always under the stresses. We are facing the stresses. Those stresses may be the psychological stresses, those may be the physical stresses, those may be the environmental stresses. And all those may be due to the lifestyle, our own lifestyle generated stresses, and those stresses result into the disease. And then the response to those stresses of each individual is different. हर एक आदमी, जैसे इस हाल में अभी बैठे हैं, अभी मुझे लगता है 2:45 या 2:30 या 3 बजे. We are hungry, we are exhausted. everybody will understand. And this will result into some kind of the distress in our body. That will result into some kind of the disease. But the handling of this stress in each and every individual is entirely different. हर एक का इस स्ट्रेस को हैंडल करने का अलग अलग अपना अपना तरीका है. Not psychological, but body's handling is also different. That is called as resilience. How much resilience our system is, and the more resilience, the less diseases will be. More rigidity, more diseases will be. So stressor is there, stressors are there, biological response will also be there, and then recovery will be there. But the recovery or biological response is different. Resilient systems, stress, perturbation, recovery, and homeostasis. And vulnerable systems, stress, perturbation, incomplete recovery, progressive dysregulation, and disease formation. Can we measure this capacity to recover before disease becomes clinically apparent? And that is, in other words, we are saying that this is the biomarker. कि उस जो रेजिलियंस है हर एक व्यक्ति में, उसको क्या हम मेजर कर सकते हैं और क्या उसको हम बढ़ा सकते हैं? We have to think on that. So as I'm saying that a patient or person is not an average. Now today's modern medical science works on the average. They conduct some trial, they find some results, and then they statistically calculate, and then an average is tried, and they work upon on the basis of that average, the treatment for all is designed. But the person or the patient is not an average. That is very important, because again I am saying that there are different trajectories. Different trajectory means the same person, same disease, the treatment may be different in every person. That is the Ayurveda principle. In modern medical science, more or less, for same disease, same treatment. Where Ayurveda varies, the same person but different treatment. And when there is same treatment for same disease, the trajectory of the response is different according to Ayurveda. आयुर्वेद ये कहता है कि एक ही व्यक्ति में, अगर अलग अलग व्यक्तियों में अलग अलग चिकित्सा दी जाती है, एक ही तरह की चिकित्सा दी जाती है, तो उसका रेस्पॉन्स व्यक्ति के अनुसार, उसकी प्रकृति के अनुसार, उसको दोषों की स्थिति के अनुसार, उसके ऋतु के अनुसार, उसके काल के अनुसार, द रेस्पॉन्स विल वेरी. या एक ही उसको डिजीज है, उसको अलग अलग ट्रीटमेंट की आवश्यकता हो सकती है, अगेन डिपेंडिंग अपॉन हिज प्रकृति. सो द ट्रैजेक्टरी, देयर आर गिवन द 3 एग्जांपल दैट द ट्रैजेक्टरी दैट डिफर्स. हमारा ट्रीटमेंट का रेस्पॉन्स प्रत्येक व्यक्ति का डिफरेंट होता है. कोई भी, मेरे को अगर कोई ट्रीटमेंट दी जा रही है, माय रिस्पॉन्स टू दैट ट्रीटमेंट विल बी डिफरेंट, and the response of other person for the same treatment will be different. Similarly, for the same disease, I will require different treatment, whereas other person may require the different treatment for the same disease. So there are different trajectories, and we have to work on these trajectories. The future of the medicine is not to treat the diseases; it is to understand the individual who has the disease. जिसको जो बीमार है उसको हमें समझना पड़ेगा. ट्रेडिशनल विजडम इनटू एविडेंस बेस्ड साइंस, द फ्यूचर हेल्थ केयर. नेक्स्ट. So on the basis of all these principles, we can say the future of medicine is not one size fits all. And I'm saying, coming to that principle, that the same treatment cannot be prescribed to all the individuals, as is happening nowadays, more or less in modern science, because we have to assess many factors, and we have to choose the right intervention for the right person at the right time. That should be the principle. Ayurveda into the precision medicine. That means Ayurveda into precision medicine. That will give excellent results, and that will generate the evidence. Because there is a strong principle of Ayurveda, पुरुषम वीक्ष्य सा ज्ञेयो विशुद्धोत्तम. हमें हर एक व्यक्ति को इंडिविजुअल तरीके से, पर्सनलाइज वे से उसको अटेंड करना है, असेस करना है, नॉट इन जनरलाइज वे. वी कैन नॉट ट्रीट द ग्रुप्स, वी हैव टू ट्रीट द इंडिविजुअल, वी हैव टू कंसिडर द इंडिविजुअल. Rather than the word treat, it will be the, we have to think about the holistic aspect of the individual. The scientific bridge, classical concept of Ayurveda, concept hypothesis, but Ayurveda gives us the hypothesis. It gives us the questions. It gives us the lead. जो हमारा आयुर्वेद में जो सिद्धांत है वो आज के वर्ल्ड में, आज के इस वैज्ञानिक युग में वो सिद्धांत एक प्रश्न हाइपोथेसिस, और उन हाइपोथेसिस पे हमें फर्दर काम करने की आवश्यकता है ऑन द बेसिस ऑफ द मॉडर्न साइंटिफिक methods, on the basis of the modern scientific tools, on the basis with the help of the AI. We have to work upon these systems. So we have the hypothesis from Ayurveda, and then we have to develop the mechanism, the clinical trial, the application, real world evidences, and health system impact. उनका health system पे क्या impact होता है, and that will give the evidence. What science can investigate. These are few examples where the today's science can act and can investigate. हम अग्नि की बात करते हैं. अग्नि is the important principle, one of the most important principles of Ayurveda. But how we assess the अग्नि? हमारी समझ अग्नि के बारे में अपने आयुर्वेदिक सिद्धांतों के ऊपर हो सकती है, लेकिन अगर हमें उसके एविडेंसेस जनरेट करने हैं तो हमें उसकी मेजरेबल जो नेक्स्ट हेलो यस हम आम की बात करते हैं. वेरी कॉमन प्रिंसिपल. आम वी टॉक, वी डिस्कस, वी ट्रीट and we successfully treat. But what actually आम is, आम है क्या? How we can make the today's scientific world understand about आम. Then for that we have to work upon with the science. ऐसे ही प्रकृति के ऊपर बहुत बड़ा काम हो रहा है, बहुत ज़्यादा काम उसके ऊपर हो रहा है. The modern world has also understand that phenotype they are different. वो बिल्कुल डिफरेंट हैं. तो जैसे उस सिद्धांत पे काम हो रहा है, ऐसे ही अग्नि पे, ऐसे ही आम पे, ऐसे ही ओज पे, ऐसे ही दिनचर्या पे, ऐसे ही रात्रिचर्या. These are just few examples. These are not the limits. These are few examples on which are the strongest principles of Ayurveda, and they need to be worked upon on the basis of the modern scientific tools. Not equivalence, not assumption. Scientific hypothesis is to be tested. हमें जो हाइपोथेसिस हमें देना है उसको टेस्ट करने की हिम्मत होनी चाहिए ऑन द साइंटिफिक बेसिस. और जो उसका रिजल्ट आता है आफ्टर विगरस साइंटिफिक वर्क, व्हाट द रिजल्ट विल कम, पॉजिटिव, नेगेटिव, व्हाटसोएवर, दैट वी हैव टू डिसाइड. ये नहीं है कि चरक संहिता में लिखा है, चुषु संहिता में लिखा है तो वो आपको बात है, हमारे लिए आपको बात है. जैसे मैंने शुरू में था, दुनिया के लिए वो आपको बात है. उनके लिए एक स्टेटमेंट है, एक हाइपोथेसिस है, एक क्वेश्चन है. दे नीड टू टेस्ट. They require to test that hypothesis. So we have to come up with the hypothesis. We have to come up with the question. We have to come up with the scientific question. We have to come up with the scientific inquiries, and we have to prove those hypotheses are disadvantageous. These are few examples जहाँ पर कुछ सिग्नल मिले हैं कि हमारे प्रिंसिपल जो हैं वो साइंटिफिक इस पे सही सिद्ध हो रहे हैं. योग में है, आयुर्वेद में मेटाबॉलिक हेल्थ या क्रॉनिक डिजीज और मेडिसिन प्लांट की लाइफस्टाइल की, ये बहुत सारे ऐसे प्रिंसिपल जहाँ मॉडर्न साइंस या मॉडर्न जो साइंस है वो उस पर काम करके एविडेंस जनरेट करके लगभग ये सिद्ध हो रहा है कि ये प्रिंसिपल्स हमारे सही हैं, अच्छा काम कर रहे हैं. वी मस्ट स्टॉप आस्किंग कैन साइंस प्रूव आयुर्वेदा. ये हमारा क्वेश्चन नहीं होना चाहिए कि क्या साइंस आयुर्वेद को साइंस जो है प्रूव कर सकती है. वी शुड आस्क व्हिच आयुर्वेदिक इंटरवेंशन वर्क्स फॉर होम, फॉर व्हाट, एट व्हाट डोज, विद व्हाट सेफ्टी एंड विद व्हाट आउटकम. दीज आर द ग्रॉस क्वेश्चंस द scientists should ask. The next generation of the Ayurvedic research is the evidence ladder. This is the evidence ladder. Next, yes, this is the evidence ladder on which we have to work. अगर हमारे खास करके हमारे जो यंग स्कॉलर्स हैं, यंग स्टूडेंट्स हैं, मैं फिर से बार बार कह रहा हूँ कि हम सब लोगों को माइंडसेट चेंज करने की जरूरत है. और जो फैकल्टी यहाँ पर बैठे हैं, मेरा एक रिक्वेस्ट है कि हम अपनी जो यंग साइंटिस्ट हैं उनके माइंडसेट को चेंज करें और साइंटिफिक वर्ल्ड की तरफ, साइंटिफिक इंक्वायरी की तरफ, साइंटिफिक मेथड्स की तरफ, साइंटिफिक प्रोसीजर्स की तरफ हम उनको लेके जाएं। द न्यू साइंटिफिक इकोसिस्टम आयुर्वेदा एंड अराउंड। अब जो नया आज का जो नया वैज्ञानिक युग है और जो हम आयुर्वेद की बात करते हैं, कुछ बड़े बड़े एरियाज हमारे सामने हैं जिनके ऊपर हम काम कर सकते हैं। जीनोमिक्स, मेटाबोलोमिक्स, माइक्रोबायोम, सिस्टम बायोलॉजी, न्यूरोसाइंस, AI, digital health and clinical science. These are the gross areas of Ayurveda or for Ayurveda, or with the help of the science, we can work on these areas and we can find some evidence, find some method and can help the society. Next. I was talking about this because there is interface of the slide. So these are the areas which I just talked about, that the Ayurveda and around it, genomics, metabolomics, microbiome, system biology, neuroscience, AI, digital health, clinical science. These are the areas upon which we can work, which generate the evidences, and these are the bigger areas. इसमें हम बहुत कुछ कर सकते हैं. Next. So can we build a digital twin of the health? Again, these are the areas: prakriti, multiomics, sleep, environment, lifestyle, biomarkers, phenotype, etc. These are areas upon which the science can work, and we can then predict, personalize, and prevent the diseases and can generate the evidence. Only need is to engage yourself, change our mindset, to strive for the questions, scientific inquiry, and then to generate the hypothesis and then work scientifically upon them. And the world is ready to help us so far as the science is concerned. All institutions are ready to help we people to test all these hypotheses and to stand with the science to generate the evidences. So India has something which the world needs. Next. Ayurveda will not merely survive the future healthcare, but will shape it. So if we all go together, walk together, we can shape the future of the health science, not medical science only, health science. We want to make the persons healthy, not just want to treat the diseases. So thank you very much. Thanks a lot. So any questions or suggestions? Yes.
Good evening, everyone. Myself, from UG batch 2324. First of all, I'd like to thank you, sir, for such inspirational session of yours. As we don't get such opportunities often to witness such great people around here, I have a question, sir. When we study, there are some classical texts which are not directly correlates with modern sciences, and at that stage it becomes dilemma how to understand that, as we are young and we are going through texts for the first time and are in process of learning. So how do we tackle that when we are talking about getting evidence in support of modern sciences to Ayurveda?
Your question is that sometimes there are some areas where you do not understand, and you cannot interpret those facts on the basis of the modern science, right? So you are right. So that is why there are many areas that where we need to work upon. So that question I just put, that we have to generate the hypothesis of उसका एक question हमें बनाना पड़ेगा, and if possible we have to find out the answer from the modern science, and that becomes the topic of the research. At present, for the examination purposes, you can, simply I can say you can ratify that. But you have to keep that worry in your mind and you should try to find out the answer of that debate. Right? The scientific method. Many things were, when we were the students like you, there were many things which were not. Simply, मैं सभी जो हमारे आयुर्वेद के बस्ती चिकित्सा को चिकित्सा अर्थ कहा गया, सभी मानते हैं इस बात को, चिकित्सा अर्थ का। हम ग्रेजुएशन लेवल तक ये कभी समझ ही नहीं पाए कि बस्ती चिकित्सा कैसे हो सकती। सिंपली एक आंसर करता था कि बात का संबंध करती है, अपान वायु का ये करती है। दिस वाज अ सिंपल एक्सप्लेनेशन, बट टुडे ऑन द साइंटिफिक ग्राउंड्स वी कैन अंडरस्टैंड दैट गट इज द सेकंड ब्रेन ऑफ द ह्यूमन, एंड there is the gut brain axis. Gut harbors many microbiomes and that is called as the gut microbiome. And if our microbiota that gets disturbed, then whole of the system, whole of the body and mind that gets affected. And once the microbiome of gut is affected or disturbed, it takes too long to get it correct. जिसको हम अग्नि से भी that is another issue. That अग्नि से कहीं ना कहीं उसको कोऑर्डिनेट कर सकते हैं, not as a whole but a part of अग्नि. So आज जब हम ये समझते हैं कि माइक्रोबायोटा जो है या गट माइक्रोबायोम इतना इंपॉर्टेंट है हमारी हेल्थ के लिए कि इफ गट माइक्रोबायोम इज करेक्ट देन वी कैन लिव हेल्थी. आज जिनका गट माइक्रोबायोम डिस्टर्ब है उनको स्टूल फीकल ट्रांसप्लांट किया जा सकता है जस्ट टू करेक्ट द गट माइक्रोबायोटा ऑफ द पर्सन. सो दैट इज द इम्पोर्टेंट हाउ वी अंडरस्टैंड दैट. आज हमें समझ आता है कि बस्ती जो है this is one single factor. There are many other factors about it. But आज समझ आता है कि बस्ती के साथ उस समय कैसा था. उनको ना तो गट माइक्रोबायोम का पता था ना गट माइक्रोबायोटा का पता था. But they worked upon the strong principle and those principles stand true today on the scientific evidences. So there are many areas. ऐसे बहुत सारे एरियाज आएंगे जिसमें आपको इस वक्त समझ नहीं आएगा. अब निद्रा की बात करें, स्लीप की बात करें, जल्दी सो जाना चाहिए. क्यों सो जाना चाहिए ये हमें समझ नहीं आता. लेकिन आज हमें पता है ऑन द बेसिस ऑफ द साइंस दैट वी इन आवर body each and every cell is having a biological clock and particularly our brain is having a biological clock, circadian clock जिसको कहते हैं. और हमारी पूरी बॉडी का सिस्टम जो सर्केडियन क्लॉक से कंट्रोल होता है. एक हमारा बड़ा सिद्धांत है यथ पिंडे तत् ब्रह्मांड. जो पिंड में है जो शरीर में वो ब्रह्मांड में, तो ब्रह्मांड में मीन्स द व्हाट द incidences happening in the globe, they are affecting directly or indirectly our body. हमारे शरीर को वो सीधे प्रत्यक्ष या अप्रत्यक्ष रूप से प्रभावित कर रहे हैं, लेकिन हम उनको इग्नोर कर रहे हैं. हमारा सिद्धांत आयुर्वेद का ये सिद्धांत कहता है कि शाम को जल्दी खाओ और जल्दी सो जाओ और खाने से के बाद एकदम लेटना नहीं. लेकिन हम उसको पूरी तरह पाया नहीं. आज क्या हो रहा है, एवरी थर्ड इंडिविजुअल में जितने लोग हैं उनमें से 30 या 33% इंक्लूडिंग मी आर हैविंग द फैटी. मोर इससे भी ज्यादा हो सकता है. और फैटी लिवर क्यों हो रहा है? बिकॉज ऑफ आवर लाइफस्टाइल एंड डाइट एंड डाइट. वी आर ऑलवेज वायलेटिंग द कोड्स व्हिच आर ऑलरेडी प्रिस्क्राइब्ड. लेकिन जब मॉडर्न साइंस कहती है फिर हमें होश आता है. जब मॉडर्न लैंग्वेज में उसको उसी बात को कहा जाता है तब हमें होश आता है. मॉडर्न साइंस जब कहती है कि भाई सनसेट के आसपास हमें खाना खा लेना चाहिए, जल्दी खाना खा लीजिए, जल्दी सो जाना चाहिए. वाई? बिकॉज अवर होल सिस्टम, अवर एक एग्जाम्पल है, अगर लिवर का एग्जाम्पल है, लिवर सिर्फ तब हील होता है जब अंधेरा होता है और जब हम सो. जैसे ही सन हीलिंग, आपको पता है लिवर जो है वो पूरा दिन हम उसको खाने से पीने से डैमेज करते हैं और रात को वो हील होता है. लेकिन रात को हम टाइम कब देते हैं, 11, 12, 1 बजे सो रहे हैं, खाना हम 10, 11 बजे खा रहे हैं. वी आर बर्निंग द लिवर. और सुबह लेट उठ रहे हैं, उसका हीलिंग शुरू हो जाना चाहिए था सुबह जब हम अर्ली मॉर्निंग, जिसको ब्रह्म मुहूर्त हम कहते हैं, लेकिन वो सब कुछ मिस कर दिया हमने. अल्टीमेटली वी आर रिजल्टिंग इनटू, वी आर ट्रेंडिंग इनटू द डिजीज वर्ल्ड. आज तो यंग जो है फाउंडेशन को आज वो महसूस नहीं हो रहा है, लेकिन जस्ट आफ्टर 40 और 45 वी शैल feel that what has happened to my body, because I have violated all those principles which were recorded there, which were written there, but I never understood those, I never relied on those, and I never practiced it. So that is why that is why I am saying that we have to work on the preventive aspect. Treatment तो ठीक है, आज के युवा को, आज के लोगों को हमें ये बताना चाहिए कि आपकी दिनचर्या, आपकी रात्रिचर्या, आपका खाना पीना कैसा होना चाहिए. We as Ayurveda fraternity have failed totally in this. हम आयुर्वेद के होते हुए हम बिल्कुल फेल हैं, पौधे तक चाहिए नहीं पा रहे. Thank you.
Sir, as you told that Ayurveda, whatever the text written in our, whatever the matter written in our Ayurvedic text, that is hypothesis.
That is not hypothesis. We have to generate hypothesis out of that. हमें मॉडर्न वालों को देना है. जैसे बस्ती चिकित्सा की बात की, हमारे लिए वो हाइपोथेसिस नहीं है, लेकिन मॉडर्न को टेस्टिंग के लिए वो हाइपोथेसिस करें. और बस्ती treats the diseases and it is the major part of the treatment. Prove. We have to give them the hypothesis. This is the question. I know that संचय काल में अगर दोषों का अपहरण हम कर देते हैं तो हम डिजीज को प्रिवेंट कर सकते हैं. ये मेरी फिलॉसफी है. बट फॉर द मॉडर्न मेडिकल वर्ल्ड वी हैव टू गिव हाइपोथेसिस दैट दिस इज माय हाइपोथेसिस. यू प्रूव ऑन द साइंटिफिक.
थैंक यू सो मच सर. और मैं इस सत्र के अध्यक्ष डॉक्टर वेंकटेश जोशी सर को आमंत्रित करती हूँ कि वो 2 शब्द कहें.
आप सभी जानिए अवसर आज दुनिया में एक 2 प्रक्रिया से समझिए, कन्वेंशनल सिस्टम, नॉन कन्वेंशनल सिस्टम. These are the 2 parallel lines of the train of the health, where the health train takes its directions only in the junctions where it is needed. We know how important our Eastern values of the Indian knowledge systems has influenced the global level. How do we understand our significance when the whole world is looking towards us and we should not be going after them? The reasons I am telling about the practice-based evidence or evidence to build up to do the practice. These are the 2 different aspects. And in the whole world, when it is looking towards the east, royal families, they take treatments in India. Why they will come? When you have your values core being preserved into the practice and wellness being established, and the rest of the people will follow you. And it is their responsibility that whether it is scientific or not. Our science is well nurtured from the ages time immemorial. And we have a lot of evidences for that when the world is after us. So well, we preserve and we practice, we make our standards very high, where the world will look at us and come to us to learn the things what they don't have. And that is the reason why my opinion is, it is the 2 parallel lines. One way the research, as Doctor has mentioned, Sharmaji, is important for us to show and bring the awareness about our systems. But then our systems are existed on the basis of the merit of the truth, on the basis of the Shastras, Pramanas, and what is that, Aptopadesha, which will never change. The principles will never change, whatever the times will come eventually. Then we have to prove ourselves to be identified into the wellness of the global health and contribute and integrate what it is required to the present understanding. And one way it is the infectious diseases or the acute conditions, another way it is the life-sustaining, life-promoting and contributing sciences. That way Ayurveda has a role to play, a key role to play and integrate into the modern health systems without losing our own values and principles where they are the eternal. Ayurvedo Shashvato Nirtishyate Anadhitva Svabhavata Prabhava Samsita Lakshanatva Bhavasvabhava Nityatva, which will never change. So we don't have to change, for the sake of science. The science will come to us for the change what we have adopted in our societies and show the wellness to the well-being how it is established. Thank you very much.
Thank you, sir.
सर का बहुत बहुत धन्यवाद। और वह द्वितीय वैज्ञानिक सत्र है वो अभी समाप्ति के, प्रथम वैज्ञानिक सत्र अभी समाप्ति की ओर है, द्वितीय इसके बाद शुरू होगा जो कि लंच ब्रेक के बाद होगा। मैं मंच पर आमंत्रित करती हूँ गोविंद सहाय शुक्ल सर को कि कृपया आए और इस सत्र के अध्यक्ष डॉक्टर वेंकट हरिन जोशी सर का सम्मान करें। थैंक यू सो मच टू ऑल। और इसके साथ ही प्रथम वैज्ञानिक सत्र समाप्त होता है और अभी लंच ब्रेक है। आप सभी से आग्रह है कि कृपया लंच के बाद इस सभागार में पुनः उपस्थित हो जाएंगे समय पर, ताकि द्वितीय वैज्ञानिक सत्र समय पर आरंभ किया जा सके।
थैंक यू मैम।
मेरा डॉक्टर अभिमन्यु कुमार सर और तनुजा मैडम से आग्रह है कि वो इस सत्र की सत्र संचालिका डॉक्टर नीतू मैडम को सम्मानित करें। सर प्लीज।
मार दीजिए।
सभी लंच के लिए जा सकते हैं, बट एट 3:30 सभी को इस सभागार में उपस्थित होना है, क्योंकि शार्प 3:30 बजे से द्वितीय वैज्ञानिक सत्र शुरू हो जाएगा और आप सबों की उपस्थिति अत्यंत ही अनिवार्य है।
थैंक यू मैम। चल रहा भाई, आधा घंटा तो टाइम है। वैज्ञानिक सत्र कितने ना बढ़िया से हमारे विषय में चल रहा था, मैक्सिमम यही देखा है। बनाए थे मेडिसिन।